neatly as the last one did. 1 second, please. So let's talk about the effects of exercise. Now, obviously, I've included all immediate short and long-term effects of exercise here. We are really only interested in this session for that which is inside my circle here. Okay, now can I stress that does not mean this is irrelevant. It does not mean that this is irrelevant. It just means it hasn't been listed on the AEI. So therefore, you very may well get a multiple choice question on these, for example, or a 1 or a 2 marker, but we're going to focus on here. What happens in the months and years after regular, and I really think we should be thinking about it in that way, regular exercise? Well, these are the things that happen. Now I can go through them. I'm going to pick a few out for you, and I'm going to pick out this one. I'm going to pick out this one. I'm going to pick out this one, and I'm going to say that these, if you like, these are effects. Well, I suppose you could say here as well. These are what you would call CV effects. Okay, cardiovascular, respiratory. I'm talking about cardiovascular. These are the effects that are happening sort of like to the body system. The others are kind of more general changes to the body, changes to the components of fitness, change to body shape. We agree with all of that. Just a reminder, increased size of the heart. We can call this myocardial or simply hypertrophy. It's a nice term to get into your answers if you're able to. Also, for lower resting heart rate, if you want to be super posh, you can say that a person will become bradycardic or experience bradycardia if their heart rate at rest falls below 60 beats per minute. But folks, look, long story short, learn those things, will you? And make sure you can put them into an answer. Now, with that in mind, let's actually have a look at an answer. I'm specifically looking to identify, nothing more than that, just to identify 3 long-term effects of exercise on what? The cardiac system. So my muscular endurance is not relevant, my change in body shape is not relevant, only these things. So what have we got? Hypertrophy, that increasing of the heart. We've got decreased resting, what I'm trying to say, decreased resting heart rate, and of course an increase in overall CV endurance. So make sure you're able to pick out phrasing like that so you can answer specifically, not just know the list of stuff that you've got.